So if we've determined at this point that you do have advanced arthritis of your knee and that knee replacement surgery is for you, I'd like to take a couple minutes just to talk about what knee replacement entails. Most people have a preconceived notion of what knee replacement is, and it's often very different by the time we have a chance to really talk about the procedure and talk about what it's like. So total knee replacement surgery is really a resurfacing procedure. Most people in their mind think about knee replacement surgery as a large bone-cutting procedure where the end of the femur and the top of the tibia are fully removed and then a large prosthetic is placed inside the joint. And that's not really what we're doing. We're really doing a more resurfacing type of procedure. Once we enter the joint surgically, we're able to retract the kneecap off to the side, and then we're able to expose the end of the bones on both the femur, the thigh bone, and the tibia, the shin bone. What we're accomplishing is that we're creating a cap on the end of the femur, again, a resurfacing of the femur to smooth that out. So we size and rotate and make that very custom for the individual in surgery. And we do a very similar process on the tibia where we're smoothing out the very top of the tibia. And there is a little bit of a stem, almost like a post in the ground on the tibial side. And both the femur and the tibia components are then cemented into the bone for long-term fixation. As we talked about arthritis being a condition of wear and tear of the cartilage on the joint, the way we replace the cartilage is with a plastic shim made up of a polyethylene plastic that locks into the tibial base plate. That's what the femur component glides on in a knee replacement to provide the range of motion needed to get back into life activities. The final piece of the puzzle is to resurface the kneecap or the patella. That is also resurfaced with a piece of polyethylene that is cemented into the bone that then rearticulates with the end of the femur. So every portion of the knee that articulates and is arthritic is fixed and is made smooth in a knee replacement, or what we like to call a knee resurfacing procedure.